All right. Hello, everyone. Good morning, good afternoon, good evening, depending on where you're joining us from. We are very pleased to have you here. And thank you and welcome to our third and last webinar. We've had a series that has been looking at safeguarding adolescent sexual reproductive health in the current funding crisis. And today, as we wind up this journey, we want to welcome you all. Please use the chat function to post any comment or to introduce yourself and where you're coming from. And please use the Q&A section at the bottom of your screen, of your Zoom screen, to post any question. We will address the questions as we continue. And at the end, whenever you have some time, we will continue to address your questions. So today, it's our third webinar, and it's on building equitable partnerships. Next. And we want to facilitate critical dialogues on global health funding and decolonization efforts with a panel of experts. Next, on adolescent sexual reproductive health and rights. And our first webinar was really to share key messages from a commentary on the impacts of the drastic cuts on adolescent sexual and reproductive health. And our key takeaways were that despite adolescents comprising a quarter of the global population, the development assistance for that particular group of people is not coming decision making, equitable partnerships, and centering communities and youth national ownership. Next. Webinar 2, our key takeaways is that we heard from various representatives and especially government representatives to show the kind of work that they are doing to make sure that any kind of advancement that has been done within the adolescent sexual reproductive health and generally adolescent well-being are not taken back. And so we heard from countries such as Benin, Nepal, and Argentina, and we came out saying that safeguarding adolescent health requires the empowerment of young people as active agents of change, and of course to advocate for increased country funding and quality assured contraceptives and services to adolescent health and well-being, and of course not forgetting political commitment to ASRH programs. That came out strongly from the government representatives. Next. So today, we are going to showcase actions that have been taken by funding agencies, and we are pleased to have some of the most impactful funding agencies in the world. And of course, to see also how technical support agencies have actively worked to build equitable partnerships with partners, especially in low and middle income countries. Next. So today we are going to hear from Dr. Chandra, who has worked with the WHO for more than 30 years, and is going to talk to us about the current status, and is also going to tell us, it's going to also usher in the discussions that we are going to have with our distinguishable panelists, whom I'm going to introduce to you later after his presentation. Chandra, you're welcome.
Thank you very much, Peter. And greetings to you all. In my short presentation, I will aim to frame the panel discussion which will follow, which really is at the heart of this webinar. The next slide, please. In the 30 years since the landmark conferences of Cairo and Beijing, there has been notable progress on the areas of adolescent sexual and reproductive health and rights that the world invested in. An adolescent girl today is much less likely than her peers of 30 years ago to be a child bride, to be an adolescent mother, to die of pregnancy or childbirth-related causes, and to experience female genital mutilation. Both girls and boys are less likely than their peers of 30 years ago to be infected with HIV and to die of HIV-related causes. All these progress did not happen by chance. It was because of actions from the global, through the national, to the local level. And it was earned through hard work and investment by countries and investment by international organizations which supported countries. So hard-earned progress, but tangible progress. Next slide, please. Earlier this year, the world watched with horror with the way in which the Trump administration vilified USAID, humiliated its staff, and shut down its operations, canceling agreements and cutting funding from one day to the next. That is what our commentary, shock unleashed by recent US administrative actions cannot lead to paralysis, is about. Lucio, who's the co-moderator of this panel, is a co-author of this paper with me and Professor Blum. So these cuts have an important consequence in terms of progress across the board in many areas. But what we are concerned about in this webinar is adolescent health and adolescent sexual and reproductive health. Next slide, please. We talk a lot about USAID cuts, but it is not just USAID cuts. As you can see from this OECD report, Organization for Economic Cooperation and Development report, many countries have cut funding, although they have not been as drastic and as dramatic as the US government. And the organization has recommendations to donor countries, and one of its key recommendations is please coordinate with the recipient countries when you make decisions. It has also set out recommendations for recipient countries on this slide. But the first one about coordination, about joint action is what this webinar is about. The next slide, please. So where are we? Funds have been cut, and the results of that are already beginning to be seen. A snap survey of 20 countries in the different parts of the world by PMNCH, the Partnership for Maternal, Newborn and Child Health, shows the data on this slide. Reduced or uncertain funding, downsized programs, temporarily shutting down activities, permanently closing down activities. And not at all surprisingly, sexual and reproductive health programming was most vulnerable. When funds have to be cut, issues such as comprehensive sexuality education, contraceptive services for unmarried adolescents, those are the kinds of issues that are cut because decision makers may see them as optional extras. Next slide, please. This paper by Stover and other authors, published in the Lancet recently, projects that if funding gaps are not filled from domestic or external sources, there are likely to be dire consequences. Increased deaths from a number of countries, reduced availability of family planning, of safe maternal health care and safe abortion care services, leading to a number of sexual and reproductive health consequences, as you can see in this graph and in this text. The next slide, please. But these are not just ideas. Look at what happened in England and Wales. Now, England is a G7 club country, a high-income country in Western Europe. It had a highly successful teenage pregnancy strategy between 1999 and 2009. 2010, the government changed. Priorities changed. They stopped funding the teenage pregnancy strategy. Champions within government and outside government tried to continue progress, and it continued the progress. But now, because of a combination of factors, cost of living crisis, cuts in government funding, and misinformation on social media by influencers that contraceptives are dangerous for young women, has led to increases in adolescent teenage pregnancy in England. And this can happen in all our countries if we are not careful. My next and last slide. My next slide is WHO has just published guidance called Responding to the Health Financing Emergency. Tedros, our Director General, has said sudden and unplanned cuts to aid have hit many countries hard, costing lives, jeopardizing hard-won health gains. But in the crisis lies an opportunity for countries to transition from aid dependency to sustainable self-reliance based on domestic resources. In this report, in our paper, the term allyship comes up again and again and again. Partnerships within countries and partnerships with organizations outside the country, which are interested not just in adolescent health, but also in justice, reproductive justice, and equality, and having people from low and middle income countries in the table as equal partners in the discussion. That's what this webinar is about. With that, namaste, thank you, and over to you, Peter.
All right. Thank you, Chandra. Michelle, next. Thank you for painting the picture so well. For those that are joining us now, we're not at the beginning, please use the chat function to send any comment that you have, but please use the Q&A section to post any question that you have, and we shall surely address the question. Now we are moving over to the discussions, and I want to introduce to you our moderators for today. Engelbert Rucho Bain is the head of international programs at the African Population and Health Research Center. Next, we have Elizabeth, or Liz Lam, who is a passionate feminist and advocate for sexual and reproductive health and rights, girls' rights and meaningful youth engagement. You can see from her photo and from her video that she's a youth champion. Next. And then they're going to have a discussion with our 4 panelists. Shahia Ali Manik is the Director for Social Affairs at the South Asian Association for Regional Cooperation. Next, we're also going to hear from Dr. Sam Oti, who is a Senior Program Specialist with Canada's International Development Research Center, otherwise known as IDRC. And next, and our 3rd panelist is, next please, is ASRH Belane, who is the country advisor for the Population and Reproductive Health Program at the David and Lucille Pakan Foundation in Ethiopia. And lastly, we have Nina Strom, who is a senior advisor in the Global Health section at NORAD, which is the Norwegian Agency for Development Cooperations. These 4 panelists, esteemed panelists, and our 2 discussants are going to discuss now on what is happening in the current field. And I want to welcome Lucho and Elizabeth to proceed with today's discussions. Welcome.
Okay, no, thanks so much, Peter, and can assure our audience that we could not find better panelists than those that we actually have today to unpack this at this particular point within what is happening in the international development space with funding cuts, to tell us the funder positions and the funder innovations that have been made to actually meet up with the gaps, most importantly around a very sensitive area. Even with funding that has suffered, then you can imagine how with funding cuts, these specific areas are actually suffering. Maybe we have a couple of questions to our panelists, and it's really important for us to get some context when it comes to the framing. Everybody has been talking about decolonization of global health, decolonization of funding, equitable partnerships, and I think we have the best panelists to actually unpack these specific concepts now. And maybe we're going to go with our first panelist, who is Sam Oti. And Sam Oti maybe can guide us on how funders have ensured that low and middle income country partners shape country funding priorities. I'm conscious of the fact that where Sam works, the International Development Research Center, they are leading quite a very dense portfolio of projects in sexual reproductive health and rights in the continent. Over to you, Sam. Thank you.
Great. Thank you, Lucio. And hi, everyone. Great opportunity to be here. So just for the sake of those who might not know IDRC is Canada's International Development Research Center. We are a Canadian Crown Corporation, a funding agency set up by an act of Parliament in Canada about 50 plus years ago now. And what we do is that we fund research, innovation, solutions in the Global South to solve development challenges in the Global South, led by researchers in particular in the Global South. And like I said, we've been doing this for upwards of 50 years. Our head office is in Ottawa, but we have regional offices across low and middle income countries. So we have 5 regional offices, including the one for East and Southern Africa, which is in Nairobi, and that's where I am currently based. We have a relatively, I wouldn't say new strategy, but in the aftermath of COVID, we'd have a strategic plan, which we call Strategy 2030. It's a 10-year strategy from 2020 to 2030, and it's the first time in our history that we are having a 10-year strategy. We've typically had 5-year strategic plans, and I think that underscores our long-term commitment to investing in research and knowledge generation in the areas where we work. We do have 5 programming areas. Climate resilient food systems is one of them, education and science, democratic and inclusive governance, sustainable inclusive economy, and then global health. That is where I sit, and that is where our programming on SRHR and adolescent SRHR sits. And now, to answer your question, Lucio, I'm going to give I'll call it a case study, and it's not specific to adolescent health or SRHR, but I think it exemplifies one way that IDRC has been ensuring that LMIC partners shape funding priorities. And it's an initiative that we call the Science Granting Council's Initiative. It's been running since 2015, so almost 10 years now. And for those who might not know, so a number of countries in Africa and across the world have their national science granting councils. In Kenya, for example, is NACOSTI, the National Council for Science, Technology, and Innovation. And the other countries across Africa have these national science granting councils. And they are tasked with really investing in science, research, and innovation in their respective countries. But what we realized is that a lot of these councils are underfunded and under-resourced. And so we conceptualized this program, this SGCI, the Science Granting Councils Initiative, to sort of work with these science granting councils and strengthen their capacities to do their jobs more effectively. Since the initiative started, we've been working with 17 science granting councils in Kenya, Rwanda, Uganda, Tanzania, Ethiopia, Cote d'Ivoire, Burkina Faso, Nigeria, Senegal, Ghana, Sierra Leone, Botswana, Malawi, Namibia, Mozambique, Zambia, and Zimbabwe. Sorry, that's a mouthful, but that's all the countries we are working with, the national councils in those countries. And we're working with other funders. So it's a pooled fund from IDRC as well as UK's FCDO, NORAD, and I'm glad to see someone from there, the South African National Research Foundation, and the Swedish International Development Agency. And the goal of this program is really to strengthen the ability of these science granting councils to do grants, to do evidence-based resource allocation, to design and monitor research programs that are aligned with local and national priorities, and then to create a collaborative platform where all these science granting councils can work together. And I think the SGCI ethos is that it demonstrates a model where African institutions take the lead and they don't follow. So these national science granting councils, they set the agenda and they develop their own frameworks for implementation and for success, rather than following something that has been imposed on them from external funders. And so perhaps some of the achievements that we've had as a result of this is that in 5 of the countries where we work, they've now completed their national science, technology, and innovation policy reviews. And a number of them have integrated private sector partnership into these national frameworks. In fact, in Botswana, Ghana, Zambia, Tanzania, and Namibia, they've even developed commercialization frameworks for research results. So if you're a scientist working in academia and you come up with some patented idea that could go into the market, the National Council now has a framework that will enable you to commercialize that idea. And it's something that we don't see very often across Africa. So it's good to see that some countries are developing those commercialization frameworks for science and for research. And in one case, and I didn't mention this in the beginning, we actually started with 16 councils, but as a result of the advocacy and efforts of the other councils, Sierra Leone established its own national science granting council. And in terms of financial commitment, so one thing we've tried to encourage is that as much as possible, the governments also put money into these councils, because actually that's what they're mandated to do. And so far, we've seen some progress. In Ghana, for example, the government committed $50 million in seed fund to the Ghana National Research Fund. And in Uganda, we tracked increase in R&D investment over roughly the last, between 2015 and 2020. And we saw that the government's budget for R&D has increased by 3.5%. And that has been in part due to the advocacy and the success of strengthening the National Science Granting Council over there. And now we feel that these councils now have capacity. So one thing that funders don't do well in my experience is that they do a lot of capacity strengthening, but when it's time to honor that capacity, they don't honor it, right? So now we as IGRC and the other partners, we are honoring the capacity that we spent almost 10 years building. We're now going into partnerships with these SGs, these science granting councils, to launch call for proposals based on their priorities. We put in some money, they put in some money, but they take full ownership of it and that they run it. And we feel that this is the future. And I think the other funders that are working with us see this as the future. And in fact, SGCI is attracting another big funder, and we are going to see this initiative extended for another 5 years. So happy to provide more information later on, but I'll pass the mic back to you, Lucho.
No, thanks so much, Sam. I think a couple of things gathered from your talk. One, agency of the countries or the partners you work with. Two, that there is expertise in the continent and that there are things that are actually changing. Thanks so much. I know that we are going to have lots of questions for you in the chat. Maybe just in that light, I will move to Yeme Serak, who is going to speak to us, maybe from a Packard Foundation perspective. I'm aware that you have a new strategy, Yeme Serak. How do you actually ensure that your partners, the countries where you work in, and that their priorities were actually integrated into this strategy? Over. Thank you.
Thank you, Lucho. Good afternoon, good morning in your respective locations, colleagues, and thank you very much for having me here today. So I will be building on some of the themes that Sam has already started to talk about. In this shifting climate, how can funders respond to the current situation? Just to start with, for those who may not know the Packard Foundation is a private philanthropic organization. It's based in California, and it has been in business for over 60 years. And the foundation, probably most of you may know the H.P. Hewlett Company. So the main source of the funds come from the private, business, but the foundation has been in operation for over 60 years. And one of the unique features for the Packard Foundation is one of the key program areas from the beginning of the foundation has been sexual reproductive health and rights, together with other climate and other programs. So I'll be focusing mostly on the ASRH initiative for the Packard Foundation. As you have mentioned, Lucho, the Packard Foundation every 10 years or so refreshes. It is a strategy, and the recent strategy refresh was finalized towards the end of 2024. So when this new, situation and particularly, the funding context changed, we had to go back and see how our new strategy fits into this new, context. And the major shift for this strategy was in the past, the Packard Foundation used to have country programs, mostly working in Africa, South Asia, and the US. And in this new strategy, which was launched at the end of 2024, the foundation decided to move from a place-based strategy to a regional strategy. So our current strategy is a regional strategy for Africa and South Asia. And for Africa, we committed to support programs, particularly in Francophone West and East Africa, mainly looking into, the current needs and priorities, as well as other funders' intervention in the space. So our new strategy has two major objectives. The first objective is around enabling SRHR environment, supporting partners to ensure an enabling environment for SRHR, which includes powerful voices and locally grounded agenda by supporting advocates. And this came particularly as we have talked a lot about the budget, but during this context, it's not only the budget. There has been, a growing opposition, both from, globally, but also within Africa for SRHR. So it is important to come up with, a revised narrative for SRHR and to really have local voices and locally defined agenda for sexual reproductive health and rights. And this includes, us supporting and collaborating with new groups of actors, including women rights organizations, who have been, in the space supporting the women rights agenda in Africa, but who may not necessarily have incorporated the SRHR issues in their programs. So we were able to support and collaborate with key, multinational and regional organizations, women's rights organizations, to ensure that SRHR is part of their, advocacy and their agenda, as well as, protecting the enabling framework for SRHR in Africa, particularly the Maputo Protocol. As most of you know, Africa has one of the most, enabling environments, but that is also under threat. So we thought that during this time, we should support organizations and countries to ensure that either the ratification process is finalized in some of the African countries or in places where it has been ratified already, to ensure that governments commit and uphold their commitments to SRHR. So that is one of the ways that we have been trying to respond to the current climate. The other, thing within this enabling SRH, environment is collaborating with other funders and, trying to, enable and support other funders to, at least I wouldn't say that it's filling the gap, but it is really bringing new funders to really own and embrace sexual reproductive health and rights as a key human rights agenda, and for them to support the issue. The second part of our strategy is to look into better pathways to care. The foundation has been supporting many community-based organizations, service providers, including the public sector, to ensure that there is quality sexual and reproductive health rights services, both for women and girls, as well as for young people. So looking into that service provision aspect, we have been looking into what more can we do, and what are some of the new models that can enable to reach more people with minimum investment, or with less. How can we do more? And we are also exploring ways to see work with manufacturers to see better products for SRHR that would also increase access and use. So within these two major objective areas, the foundation has been trying its space to support partners and particularly to provide responsive grants. Responsive grants in a way that, as Chandra has initially, showed us the budget cut and how some organizations have been, impacted heavily. We were able to provide responsive grants, and particularly, for organizations who support grassroots community organizations or service providers, including the IPPF Africa region, to increase service uptake and to ensure that services are not interrupted for women. Within this same line, in terms of being responsive to the organizations or to our grantee partners, we have also minimized the requirements, both in terms of accessing the grant as well as the reporting and other compliance requirements. Because during this time, we also know that it's not only services, it's not only the organizations, but the capability of the implementing partners, including the public sector, has been impacted, both in terms of technical support team who were not able to provide services or who had to leave their jobs, as well as interruptions within the within the larger ecosystem. So the foundation introduced a new grant making approach, which includes minimized requirements on part of the recipients and more flexible grant making to ensure that organizations would be able to have core supports or general supports, so that funds will not be earmarked to specific intervention or activities, because again, flexibility is very, very important in such period. Within this, Sam was talking about how it is important to, encourage country ownership and priority for SRHR within, multiple priorities that governments had to make during this period. So one approach for us has been to be part and to be contribute family planning compacts arrangements. A good example has been in Ethiopia, where we joined other donors to, encourage investments from, the public sector for family planning services and commodities. During, USAID and, other, funders, traditional funders were not able to provide resources as needed. So the family planning commodities were under threat. So a good, promising approach that we have seen is when we collaborate with governments, when we provide support to government and incentivize, to have more public resources in the sector, it is possible to make a big change. As I said, in Ethiopia, the multi-donor family planning compact was able to increase funding for family planning by 18-fold at the beginning of towards 2023-24. The Ethiopian government was putting around 500,000 USD for purchase of commodities. With the family planning compact, the government was able to increase that by 18 folds. And eventually, the commitment from the government is the government will be able to, uphold its commitment and to be able to, fill all the requirements for family planning commodities within that compact arrangement. So such kinds of, domestic resource mobilization efforts, including, the support and the commitment, increasing the commitment of the government, would be an important opportunity, and this is the experience we have. And one just final opportunity for us has been collaborating with other funders. So as funders, providing siloed grants will not sustain programs. So as much as possible, supporting and collaborating with other funders would maximize resources both for the recipient countries as well as implementing partners, and it would also reduce unnecessary burden on the implementing partners. So we have been as much as possible trying to communicate with other funders, avoid silos, and mobilize resources to have bigger investments and bigger impacts in the space. So let me pause here, and then if there are other questions, I would follow up. Thank you.
No, thanks so much, Jimmy. I can assure you that you're going to have lots of questions, and I know that Liz is taking note of those questions. But a couple of things that stood out from your expose, most importantly, the centrality of aligning and involving the government in everything that you do. And I think Chandra also mentioned this from the very start. SRHR is always under stress, is always under threat, with or without funding. And it's very, very important to center the activities or the advocacy efforts that are done within this particular reality. The importance of collaborating with other funders to avoid duplication of effort, listening to community voices, and best practices in actually how we can do more with less, because that's the reality. No, thanks so much. I'm going to move now to Nina to get Nina's perspective. I know the world, I can proudly say that the world is still lucky to have Norway through NORAD that is actually standing strong when it comes to supporting, funding sexual reproductive health and rights. And I'm also aware, Nina, that you just came back from the International Conference on Family Planning. Maybe your perspective on how country priorities at the moment and in the near future could best be integrated into your funding strategy, maybe laying emphasis or coming from a NORAD perspective. Thank you.
Thank you very much, and thank you for having me in this important webinar. I think the first and the second webinar was very, very interesting. And also I think I will just sort of follow up on what we have heard from Canada and from Ethiopia and Packard. So the Norwegian government SRHR is a top priority for the current government, and as you might have seen in the wonderful OECD DAC report that Sandra presented, we are still at the level of 1% for ODA from our GNI together with Luxembourg. And we have also increased and launched in Botag in Colombia, and additional grants for life-saving SRHR for adolescents this fall. But still, with our envelope, you know, it's far from being at all filling the financial gaps. So let me just speak to how we are working and maybe also a little bit on what needs to change. So we have a policy on gender equality where SRHR, GPV, etc. is situated, and then we also have a policy on LGBTIQ, which include SRHR, and also one on people with disabilities that includes SRHR. So on paper everything is perfect, and yet we have also in the way we work, as we are a small team here in Oslo and also small team at embassy levels, we work with core support and long-term agreements. And I think that is securing flexibility for partners. We have from in NORAD's end, NORAD, the Norwegian Development Corporation, is a directorate to the Foreign Ministry and the Ministry of Climate and Environment, and we manage the development grants from Norway, that 1% together with our embassies. And so we have established a SRHR portfolio that covers various areas, including research, and the Norwegian political focus on SRHR is safe abortion, family planning, and comprehensive sexuality education. And in the portfolio, it's a TOR, it's a TFC, and it includes, as similar to Packard, that it includes community engagement and norm change and then enabling factors. It includes integration into health and education systems, and also advocacy to adopt supportive laws and policies. Now, the question is sort of, do we have the right partners? We have 30 plus partners. It includes the UNFPA, the UNFPA supplies WHO, UNESCO, and multilaterals. It also includes funds that directly reaches grassroots through Amplify Change, SAF, the Safe Abortion Action Fund, and the Robert Carr Fund. And we engage with other funders like Packard, like Canada, in the cooperation with these organizations. But then on civil society, and no complaints, but of course IPPF is a huge and important partner to us. But we also have the Care International Plan, International Save the Children, etc. But sort of when you and we need to sort of work with them and make sure or trust that they work human right based, that they work intersectional, reaches diverse populations, and focus on locally led development, and targets and work meaningfully with the adolescents and young people. Yet sort of the question is whether do we have the right organizations in our portfolio. I think it's important to have long-term partnerships. Yet, as you might have noticed, I have not mentioned governments. And in the past, a decade ago, we collaborated with other donors and partner countries in the swaps at country level to support ministries of health and education. That era has sort of passed, and we are now working a lot more through multilateral and civil society. It is creating silos. So we have to look at sort of the important thing for us is the collaboration at country level, where we might not have the capacity to be involved as we have smaller embassies covering many sectors. I also think that we have already seen also with the funding cuts that many are cutting staffs with national government donors. So the staffing issue and the capacity will be a challenge to the future. I look very much forward to hear from Packard about how you have minimized the requirements for new grants, because I think also the large partners we work with, due to our capacity, it's difficult for grassroots and other important organizations to actually reach up to the level of becoming partners to Norway. Lastly, I would like to also point to the siloing, and that our budgets are following the SDGs. So one would typically have a budget for education, for global health, for gender equality, SRHR, etc. And in addition to sort of these siloed budgets, we have the OECD DAC marks where we're also measuring sort of what is being funded, and there's a SRHR population is sort of 130 numbered, and yet there's another one on GBV and harmful practices, and these siloing in the way we measure our development assistance makes it difficult to actually fund organizations that would like to work across or are working across multisectoral and also on very logical areas such as child marriage, teen pregnancy, and school dropout. And when I say these three things, it's on 3 different budgets in my system. So these complications we need to overcome. And I think a lot more can also be done with the collaboration between funders. Yes, I think I will stop here, and I'm very look forward to the rest of the webinar. Thank you.
No, thanks so much, Nina. I think what actually stood out for me was actually the importance of collaborating with funders, and not only collaborating with funders, but having the philosophy of learning through those collaborations in how to actually get things better and avoiding duplicities. I'm going to move forward now to Shahia, who is maybe going to come in from where she sits, because we are aware that you have specific projects. Shahia, maybe you correct us if you are wrong. You have gotten some funding from the Asian Development Bank for some adolescent sexual reproductive health work there in Asia. Maybe from where you sit, how has this relationship actually worked out? And how does this particular funding or any types of funding within your particular portfolio actually integrate the priorities of the countries you work with in the working agendas? Thank you.
Thank you. Thank you so much. Thank you for the opportunity to be here. For those who don't know what SARC is the South Asian Association for Regional Cooperation. It's an economic and political organization founded in 1985 for 8 member states of South Asia. Its objective is to promote economic and social development, collective self-reliance, and mutual cooperation. Our secretariat is based in Kathmandu, in Nepal. We have 8 members of the organization: Afghanistan, Bangladesh, Bhutan, India, Maldives, Nepal, Pakistan, and Sri Lanka. So the key goals of the organization is to promote the welfare of people of South Asia and improve their quality of life. The decision making of the organization is on basis of unanimity. So we need all member states' concurrence to move forward with any program or any opportunity or any development plan we have for the region. Now, coming back to the subject matter, last year we had a regional dialogue on adolescent pregnancy. We partnered with UNICEF, ROSA, UNFPA, WHO to address the issue of adolescent pregnancy through collective regional specific actions. One really beautiful thing that came out of this regional dialogue was that we have an action plan for the region on adolescent pregnancy. So we have a regional technical brief and an action plan on adolescent pregnancy in South Asia, which focuses on at-risk, married, pregnant, and parenting girls. This regional action plan has been sent back to member states for them to develop their own country-specific action plans. Now, one of the things in this action plan is the funding opportunities for adolescents. Of course, our partners are UN partners, Asian Development Bank, and other partners. Of course, this funding cut has also impacted the work that we do, because I'm sure everybody knows that the regional office for South Asia, UNICEF, will be moved to Bangkok as well, which that now will be Asia Pacific regional office. So we are seeing it. We are seeing how WHO is also cutting down a lot of projects in the region. We are taking the issue is great, it's at hand. But something very beautiful about South Asia and the regional cooperation is that we have the SARC Development Fund. It's the official financial institute of the South Asian Association for Regional Cooperation of SARC. The headquarters is in Thimphu, in Bhutan. It was established in 2010. The main goal is to promote the welfare of the people. So the funding windows under this organization, we have a social window, funding projects that promote social development, such as those focused on health, education, and women empowerment. We have an economic window, which focuses on non-infrastructural projects related to trade, industry, and service sectors. We have an infrastructure window that supports projects in areas like energy, transportation, telecommunication, and tourism. So right now, in the region, there's a lot of stress within organizations, within NGOs, because their funding has been cut. So what we are saying is that, hold on, let's not get stressed out. The regional organization is here. We have the funding opportunity. We have a fund that is for the region, and it is for the 8 member states. And I think when you look at through all the regional organizations, SARC is the only regional organization which has its own funding mechanism. And it's for the 8 member states. So that's what we are doing currently to promote this. We are saying that don't worry, we have some funding for the region, which is contributed by the 8 member states. Let's explore that. And that is what we are also saying to our partners as well, UNICEF, WHO, and other organizations as well. We have this, let's work together, let's do our projects together. One of the many things that we discussed when earlier during the year when we were developing these action plans for country specific was, okay, so a lot of these events or a lot of these projects or a lot of these interventions are grassroots level. And a lot of the organizations who were implementing these projects, they were very worried that without these fundings that they will not be able to address these issues at the grassroots level, because these organizations, of course, has this bottom-up approach. So what we said was, no, okay, listen, let's do this. Let's bring your projects on board. We'll discuss this, because as a regional organization, if you let's say that you come through through the government or through one of the regional centers or regional partners, then the funding is a grant. You don't have to worry about it, it's a grant. But let's say that there's UNICEF coming in or there's WHO coming in, then it's a 50-50 project. They bring in the 50% of that funding, and STF gives that 50% of that funding. So, where the region is, of course, impacted by it, but we're trying to make use of what's available so that the projects run. People are not impacted. Of course, they are impacted, but we're trying as much as we can to minimize this. We are also saying that, okay, let's bring in the resources together. A lot of times what we have realized is that it's not about budgets. It's about how budgets are allocated. So we are saying, let's revise and let's look into this. Let's look into this and see how best we can work with whatever we have. Let's put together resources together. There's a good projects that's happening in India. There's a good projects that's happening in Nepal. Let's take it and let's see how well we can work on it in Maldives, or how we can implement it in Bangladesh. The region. These projects are not things that's coming from high-income countries where it's not adaptable. These are regional projects that can be implemented. So let's bring on those resources together and see how best we can minimize this impact. I think I'll stop here, and I'm happy to answer any questions.
No, thanks so much, Shaya. The main takeaway that I get from there is actually making the best use of the available resources that you have, and the solutions must not always come from elsewhere. And that's actually a great model to actually reduce grantee stress. I am going to pass now the mantle to my co-moderator, who is going to lead us with the next sections of this webinar. We have lots of questions for you. Thank you.
Thank you so much, Rachel. The chat and the Q&A section have been buzzing. There are a lot of questions, also specifically for Yeme. And the questions for Yeme are basically around, what kind of organizations does the Packet Foundation support? In what countries? When does the new funding cycle open? So I don't know, Yeme could be able to speak to that. And then thereafter we can, for just a couple of minutes, and then thereafter we can listen to some of our other panelists to answer some questions that have been raised around. There's one question in the Q&A section that asks, in the face of fragmented policies and the funding crisis, how can we ensure that the forgotten voices and sexual and reproductive health rights of adolescents and young persons with disabilities are upheld? So I'm just going to pass it on to Yeme to answer the question around the Packard Foundation's funding cycles and who their target audience is.
Thank you. Thank you. I'll be very quick. I know we're running short of time. So I would encourage everyone who has questions to check the website for the Packard Foundation, and there is a full information around the strategy and our approaches. But generally, the way, as I mentioned earlier, we work at a regional level, so which means East Africa, which is using the African Union definition of East Africa, and Francophone West Africa. So every country within that category is basically eligible. But the way we do is it's not just specific one country investment, but we try to look into, initiatives that can run across, multiple countries and which can also impact the larger ecosystem and the regional frameworks. So the Packard Foundation has always worked with local and community-based organizations, as I said. And we also use, coalitions like the Odaguru Partnership, the OP in West Africa, which is a mechanism to reach many countries working around family planning in the West African region. So we are part of that partnership. As I said, we want to be more of, collectively supporting and collaborating with other donors. And then another, framework that we use is the ODAS safe abortion mechanism, which is also, working across number of countries. And then it is a donor collective effort to influence, programs. But in addition to that, we also do work, fund organizations, individual organizations. One, for example, one area is Primary Healthcare Institute, which again is a regional mechanism which is working on expanding and promoting SRH within the primary healthcare system. So, the best way, to reach out to us is, you can reach out to us, you can, check our, websites, and we don't have a call for proposal. We usually do is a negotiation and discussion and trying to fit how, our support can add value to the organization and to the strategy. So that's how we use, but, our focus geography is, East Africa and Francophone West, and some of our initiatives maybe even continental because of the regional shift. Thank you.
Thank you so much, Yeme. Dear participants, thank you so much for staying with us until now. We would like to request, because we're running out of time, we would like to request if you could stay with us for another 10 minutes so that we can answer a few more of your questions and then close up properly. Thank you so much. We have other questions that have been asked by the participants, and I'd like to direct this to the other panelists. We have a question that is asking about, in the face of fragmented policies and the funding crisis, how can we ensure the forgotten voices and sexual and reproductive health rights of adolescents and young persons with disabilities are upheld? And the other question is, how do we address the issue of, how do you, panelists, address the issue of decrease in funds vis-a-vis the increase in population, which results, of course, in more challenges? I don't know if you want to take a lead on this one, Nina.
Thank you. I would like to just very quickly touch upon the question about the fragmentation and policy and the extremely important voice of people living with disability in the field of and the SRHR. And first of all, I just wanted to also point out that we are not funding projects with exception from grassroots mechanisms. And when we fund the organizations and partners, I mentioned core funding, but that is for them to implement their policy, their strategy. So we are sort of hands off on directing who should do what. And in SRHR, all partners are requested. I mean, we are sealing the partners and funding those that document that they work meaningfully with organizations of people living with disabilities, and so not just reaching people that live with disabilities, but engaging their organizations. And at the ICFP in Colombia last week, it was amazing and I was very glad to see so many sessions on the topic, and there's a lot more to do. And I think also there's a lot of advocacy to be done with and among the organizations of people living with disabilities. I think I will leave the floor so that more can engage. Thank you.
Thank you so much, Nina. I think this other question goes to Sam. You talked a bit about your organization and the work you do partnering with the organizations that you provide capacity building for. And so this question is around, from Dr. Lester, says most SRHR programs in the low and middle income countries happen to be externally funded. And as a way of instilling ownership or commitment to such important programs, could it be appropriate to request governments to at least commit a certain percentage into the financial basket, considering that one day there shall be no external funding? Could we hear your thoughts on this, Sam?
I might get deported if I speak my mind, but the issue is that commitment was made. The government's made, at least in Africa, I can't speak for other regions, but in 2001, I think, the Abuja Declaration committed 15% of every African country's budget to health. Why isn't that happening? Your guess is as good as mine. But I think there's an opportunity we are not realizing. As a result of all the funding that has come into global health over the past 10, 20, almost 30 years, we have numbers. We have highly qualified people. We have civil society groups that have, been supported. We have research organizations. I think this, compared to other development sectors, health is probably one of the most sophisticated and capacitated. And how do we turn those numbers into enough pressure on governments to do the investment? I think this is a conversation that we need to have. There's no easy answer, because I always say that there is not an issue of ignorance, right? The governments know how compromised our healthcare systems are. That is why when some of them are sick, they travel to Dubai and they travel to London for healthcare. They know how bad our healthcare systems are. So it's not an ignorance issue. I think it's us as people now in health. We need a critical mass of people coming together and saying, you need to honor your commitment. You need to put more money. We can't continue to be dependent on external sources.
Thank you so much. Thank you so much for shedding more light on that, Sam. Thank you. We have another question here that talks about how do you panelists in your work address the issue of decrease in funds vis-a-vis the increase in population, which results in more challenges. And Shaya, do you want to take a lead on this?
Thank you so much. One thing I'm really promoting right now is social protection. Social protection, financing for social protection. I think that's cross-cutting across everything, health, population, all of that. So what we are saying is that, we really need to invest in it. And one method that we're really pushing now is that, okay, so we have the government, we have youth activists, we have people who are pushing this agenda. We're also trying to bring in academics into this discussion, because they hold such a great power in them, to push agendas, to talk about agendas, to promote it at different levels, at different settings, at different platforms. We have, if you take regions or countries, you have diaspora that is, across the world, who are qualified to talk about it. So while we are pushing, governments on this agenda of social protection, financing for social protections, more funding for healthcare, we are also asking, our academics who are across the world to promote this agenda for the region, for your countries, at which at, so that this gets addressed. So currently, that's what I'm doing. We're also we recently had a conference on anemia, for anemia or for adolescent girls and women, and majority of the people that we brought in were academics, and because of that, we are opening up a anemia precision center at the South Asian University, the SARC University, which is in Delhi, and one of our partners is a university from the US, who are giving us that funding to do this. So I think, these partnerships, these bringing in academia, talking about it at different platforms, that really helps. There's so much you can do to push governments. Sam said, the governments had committed for a certain portion of their budget to be on health, and we know what's happening there. So I think this push on these agendas through different platforms really helps, and I think that's one way to go about it. And I'm right now using that platform, so I can tell you that what I'm working on now, it's really effective. So.
Thank you so much, Shahia. As we close, I'd like to ask you, our panelists, to close us up with any takeaways you want to give us, 45 seconds to a minute, starting with you, Sam.
Yeah, thank you. Just let's not give up. I know there's all doom and gloom. Money is going away. It's easy to lose hope and to be downcast. But let's not give up. In every crisis, there's opportunity. And if we look throughout history, crisis has catalyzed innovation. The NHS, the National Health Service in the UK, was in response to World War II. Certain countries in Asia, their universal healthcare systems were in the aftermath of the Asian financial crisis, right? And even here in Africa, after COVID, we became serious about scaling up vaccine manufacturing capabilities across the continent. So let's not lose hope.
Thank you, Sam. Over to you, Yemen.
I'll just build up on what Sam has said. There is always a bright star at the end of the tunnel, and there is huge opportunities. We haven't even discussed about the climate finance opportunities. This week, in Brazil, the COP30 is happening, and there is a huge opportunity. And already health has made a great opportunity to integrate climate health issues. ASRH is not still being done well. So there are a lot of, advocates working on the integration of ASRH in the climate initiatives and programs, humanitarian integration of ASRH into the humanitarian response efforts. So again, there are opportunities. We just need to be innovative. We just need to be vigilant. And we also need to make sure that we need to do more with less. So we need to increase efficiency. Thank you.
Thank you, Yemen. I want you, Shahia, and then Nina.
Thank you. Dr. Chandra said something very nice at the very beginning when he was doing his presentation. He said people at the table has to be equal partners. And I think that is a really, that's a takeaway, whatever funding opportunity that comes our way or whatever partnerships that we do, we have to ensure that everybody at the table, they're all equal, resources we pull in together, or what funding mechanisms is established in any region. We have to ensure that all countries or all partners they're all equals. And I think that's the only way to go about it. Without that partnership, without that development plan to push each other, nothing will get done. We will still be trying to reach our SDG goals in the next 40 years to come as well. So, yeah.
Thank you, Shahia. Nina?
Thank you. And now, sir, I think I will just echo Ayman from UNFPA from the second webinar. He said that investment in adolescents SRHR is a non-negotiable, and I couldn't agree more. And he also And he also raised that it needs to be smart and sustained. Young people and adolescents, they can be so powerful, and we need to make sure that organizations that are making sure that they lead, that the young people are on their decision-making boards, and actually listen and implement what is needed. That is key. So I think I will end there. Thank you.
Thank you so much, Nina. Thank you all, dear panelists. I'd like to hand over to Peter Rock now.
All right. Thank you so much. I'm awed by all the gems that have come from here. Michelle, could you kindly project the last slide? I want to take this opportunity to thank everyone for the engaging conversation, both on chat. We have Q&A. Of course, we have a lot of questions and comments that we have not addressed. I don't think our aim was to address those. We want that to continue as a continuing discussion, but again, we will have a report where all your concerns and questions will be addressed, but let's keep the conversations going. So we'd like you to respond to the feedback to this webinar. You can scan the QR code, and Michelle is also posting, and she has already posted a link that you can also click and you can engage on that. But I want to say thank you to everyone, and particularly to our panelists, and thank you for agreeing to come. Shahia, Nina, Sam, Oti, ASRH. Thank you, Chandra, for your presentation, and thank you to all the colleagues that have made it possible in terms of organizing this webinar, and to our wonderful participants. The chat has been on fire, the Q&A has been on fire. We are very glad to have engaged with you this evening. I want to wish you a very, very great evening, and let the conversations continue. Thank you. Shukran.
I have to say thank you,
Asante.
Peter, to APHRC for hosting
Chandra.
these 3 webinars, and for the whole team that has worked together with this idea. I came to them with this idea and no money. This has been partnerships using their own resources to do something that is important for the field and for all of us. So thank you, Caroline. Thank you, Peter, and thank you all.
All right. Thank you, everyone.